Good morning, my digital pathology trailblazers. How are you doing today? 6 a.m. Friday. Can you believe that this is the 28th time that we are meeting here? Um, I don't think anybody has been here for 28 times, but if you have been here more than 3 times, let me know in the comments. I'm going to show myself the chat and say hi to everyone. And so okay, I see people joining. I always I have this little icon here when people pop up. So this is fantastic. Where you're tuning in, time is it for you? And it has been more than 3 times. I guess in the US you showed this 3 that you that yes this edition. So today we're going to start with the paper about neuropathologic image analysis, which is which is a coincidence because I recently and we have people joining. Amazing. I have to finish a sentence first before I show comments. So coincidence and made me smile because I recently was presenting at the annual meeting of the Society of Toxicologic Pathology, and the topic of my talk was digital pathology in neuropathology and for toxicologic pathology. And I did some research, right? And obviously I was focusing on image analysis because this is like the added value of digital pathology, not just the reading, but the reading makes everything so much more connected. And there is study material, or we call it study material or diagnostic material or slides that then can be analyzed with image analysis. And thank you so much for the kind words that I'm awesome. This makes my day because I wake up here at 6:03 and then I see these comments. Show up live. This is amazing. Thank you so much. Our papers. If you're joining right here more than once, and if you've been here 3 times, I'm gonna give you a special discount. Just put it in the for whatever is in the shop. Oh, so I have the QR code for Pathology AI Makeover because we just officially launched this course. I launched it to my email list, and some people are already going through it, learning AI in pathology. So if you're interested, you have this little code on the left for me on the screen in the top left, and you can check it out. And in the meantime, we will start talking about our paper. Everything working. I checked my pen and everything. So, comparison of multiple quantitative strategies for neuropathologic image analysis. Very close to my heart, image analysis, because you know what is my opinion on trying to quantify IHC other than positive or negative. IHC, I deeply feel sorry for moving. This is basically guesstimation. So, have a look. Obviously, as I already said, the traditional semi-quantitative scoring for neuropathologic assessment is prone to variability among assessors. This is what I'm referring to. I didn't have this thinner. Can I have this thinner somehow? I should be able to. Okay. So it's prone to, the semi-quantitative is always going to be prone to variability between people, right? Variability with the same person. Like, I'm not going to be as good in the morning as I'm going to be in the evening, depending on what the prime hours or best mental capacity hours are for the people. So then and also, it does not capture full spectrum of pathological changes, nor does AI, but, nor do we, right? So to address these limitations, they decided, and by they, I mean and a group from Boston, everything Boston, VA Boston healthcare system. Yeah, everybody from Boston. They decided strategy quantification or advanced artificial intelligence techniques. I love this distinction. Okay, you have like the very basic positive pixel quantification, or everything else is very advanced. I love it. Sweet. Anyway, let me just, I'm gonna bring the QR code back later, but I just don't want to obscure our view right now. But if you're interested in the Pathology AI makeover, where I break down everything AI for pathology, you can also comment. So they decided to do the advanced AI or positive pixel quantification, right? And then they did so. However, comprehensive comparison of these measures have never been performed. So they had 1,412 cases from Boston University brain banks, and then human-driven semi-quantitative scoring was compared with the computer-driven percentage area stained measures and AI-driven cellular density quantification of tau pathology, lateral frontal cortex. The advanced things that they did was basically these, which are not that advanced when it comes to computing, but definitely a lot more quantitative than what we do visually, right? So they observed general agreement between measures. So they compared each measure to themselves. So the positive pixels, then the area stained, and then the cell densities. And they had a good correlation, general agreement between measures, which is good, especially if it's a cellular staining. But they have one caveat for the pixel quantification. And also because this data set included a large range of different neuropathologies, and they decided to restrict the cases, and they decided to do the sub-analysis in cases with the neurodegenerative disease, chronic traumatic encephalopathy, and examine correlations with clinical and neuropathologic variables. So we have more data now. We have, the staining for the tau staining for the CTE. We have clinical and neuropathological data, human assessment of the staining, and also computer assessment of the staining. So all methods demonstrated significant ability to predict neuropathology. They had a problem with pixel count. Does not surprise me, because when you just count positive pixels, you may have inconsistent background, non-cellular elements staining, and artifacts increasing variability of the positive pixel method. But the AI-driven method was better at identifying pathological changes associated with sparse pathology. So overall, their results demonstrate important differences among neuropathological assessment techniques and highlight the need for careful consideration when selecting analysis method. And I totally agree with that. I think it is, I guess it's general, like property of human brain. We tend to use what we know of, like also in image analysis. And let me put my code for the book. Because this is something I describe in the book, right? And by the way, I started writing the new version. So if you don't have the book yet, the PDF of the Digital Pathology 101 is free. But I want to show you something in this book. Let me make myself big here. Okay. So, and now with the transformers and the ways of approaching image analysis, this consider even more options, but I have this picture here. Oh, here, of the giraffes. So I should be able to see them. Is it close? Come on, camera. Anyway, so on page 77, you can download it right now, you will see a picture of giraffes. I took this picture at Disney, and it basically explains computer vision concepts, and I call it computer vision to pathology vision translation. And you have 3 giraffes. And what you can do with these giraffes, depending on what you want to know about these giraffes, you can either just like put one box around them and say, these are giraffes, and that's it. If you want to know the area where the giraffes are, you can put a box around each of them and say, this is giraffe 1 to 3, but I don't need to delineate them. Then you can delineate all of them and say, this is the area on the picture where the giraffes are. Or you can be super fancy and say, oh, this is giraffe 1, exactly delineated. Giraffe 2, the one, delineate as well. Need to fancy see these like all together in one big herd. With computer vision, you don't need to do all this fancy stuff if you only need the information where all the giraffes are, right? And then, like, you know, the complexity depends on what kind of information you need. And this is a question that you need to ask yourself when you do these image analysis. And they did that, and they emphasize it in this paper that, okay, where's my code? Oh, sorry, I don't know what happened with the code. But if you're interested in the book, you can grab it through the code below, and PDF totally free. And the giraffes are on page 77 in this version. I assume on PDF it's the same version. So it is important to ask yourself, okay, do I, and these all delineated giraffes, this is called instance segmentation. And it's like the, let's call it the most fancy way of delineating on an image. And like our brain gravitates to, yeah, like we would like to have that. Do you really need to have that? Maybe you can just can have the boxes, or in this case, maybe you can just have the pixels, which is also valid, right? And if it correlates and if it brings you the same information and is such an come on, code. Okay, but I'll bring it up if anybody is interested. And of course, always, if you need something from me, any course, any book, anything that you see on the screen that I later take down, you can always send me. You can always put it in the comments. So let's move to our next candidate today. We don't have too many, so bear with me. Come on. Okay, the next one is an interesting one. It's chronic. What's with this code? Give me 1 second. Okay. Okay, and the chat, clicking here between you and all the codes and everything. Okay, so chronic changes on kidney histology by a multi-class artificial intelligence model. And who is co-author of this? Andrew Janwick, who is also the author of HistoQ's open source software, and we did a webinar together. I think you can find this webinar on my website as well. And of course, actually, you can go to the store, Digital Pathology Play Store, and you can see all the courses and everything. And there is stuff that's for free, there that's paid, and also my earrings. I'm going to show them, show the versions that we have to you in a second. Now, let's focus on the science. Okay, enough of the promo. Let's talk about the chronic changes on kidney histology by a multi-class artificial intelligence model. I want to highlight multi-class. So this is a group from Mayo Clinic, Cambridge, Emory University, Georgia Tech, and also Geneva, Switzerland. I think Andrew is in Geneva. And what they did, they say the chronic changes in kidney histology are often approximated by using human vision with limited accuracy. Have we heard that before? Human vision with limited accuracy? Yes, probably every single paper starts like that, and every single live stream or episode I start like that. That our vision is basically guesstimation when it comes to like counting something. So. And they know because they've been doing digital and this trained an artificial intelligence model for segmenting structured images of kidney tissue, and 20,500 annotations. Trained the model with 20 classes. Oh my goodness! I say that's a lot of classes for one kidney model. Can you imagine? 20 classes of structures, and they're going to tell us some of the classes, including separate detection of cortex from medulla, because there are some dependent measurements that rely on this. And they compared the AI model detection with human-based annotations in an independent validation set. So this is very much like the classical way of evaluating. The label is the human annotation, and then your prediction is the prediction, right? And you compare it to the annotation. Let's see what they actually annotated. So a model was then applied. So they trained it, they designed it, they did it. Why is my camera not working? Hey, camera, move with me. Okay, sometimes it moves with me and sometimes it doesn't. And now it doesn't want to move with me. Hey, camera. And while I like fumble with my camera, that doesn't want to move it with me. Let me know if you've been here more than once or here for 3 times. You're getting a special discount code. All right, now move. Okay, so then they applied this AI model to 1,400 donors and 1,600 patients with renal tumor to calculate chronic changes as defined by measures of nephron size. So here I'm already like get triggered. Like you visually tell people to like measure nephron size. I hope not. Maybe I hope not. But they included it, right? Glomerular volume, cortex volume per glomerulus. So here is this cortex volume per glomerulus, and mean tubular areas, and nephrosclerosis. So globally sclerotic glomeruli, increased interstitium, so like this connective tissue, increased tubular atrophy, and arteriolar hyalinosis. And also artery luminal stenosis from intimal thickening. So the inner layer of the artery gets thickened, and then you have. So they test ranges. I need to work my lines. And the results were that what happened? I switched myself. Okay. The AI detection and human annotations, the agreement was similar between human pairs, except that the AI model showed less agreement for AH, and AH was this arteriolar hyalinosis, arteriolar. So these are very tiny arteries. Would I be surprised with that? Probably not. Maybe it was confusing stuff. For sure was confusing stuff. I don't know exactly. Okay, so anybody here the second time, third time? Let me know in the chat. The results, AI detection and human annotations was similar, all good, except for this one class out of 20 classes. I think that's pretty good still. And chronic changes calculated solely from AI-based detections associated with low glomerular filtration rate during follow-up after kidney donation and with kidney after radical nephrectomy. Based was calculated from cortex per glomerulus, percent glomerulus. Pronouncing these things is pretty challenging. And then tubular atrophy foci density, as well as mean area of arteriolar hyalinosis. And these lesions showed good prognosis, discriminating for kidney failure. So basically, the conclusion is it's good. Multi-class AI model can help automate quantification of chronic changes on whole slide images of kidney histology. So I was impressed with how many classes they trained it for. And yeah, if you can like somehow have a computer aided assessment of so many things, that's really golden. What about hematology practice in the digital era? What has changed? It's a review, and the internal Journal of Laboratory Hematology, International Journal of Laboratory Hematology. So these review abstracts are a little bit challenging to at the journal club, but and this of Pennsylvania, and I'm in Pennsylvania, so hi to University of Pennsylvania. And are pretty short and not that positive, because they say obviously hematopathology is complex, but I mean, the kidney evaluation was complex too, but hematopathology is complex as well, because they include numerous data points necessary for guiding further testing, diagnosis, and patient management. What do they mean by numerous data points? Very multimodal, because we need complete blood counts, blood cell counts, and then we have subsequent morphologic evaluation of peripheral blood and bone marrow. And AI and image analysis, digital pathology as well, could potentially revolutionize the peripheral blood and bone marrow assessment. And did it revolutionize? Let's have a look at the rest of this abstract. Well, we could, implement artificial intelligence for assisted and automated evaluation, but there remain major hurdles like, and I have a star here because I don't really believe in these hurdles anymore. And anybody who's been with me during that even with for any of the 7-part series, which is a module in Pathology AA Makeover. So if you want to makeover, this is a paid course, and you're gonna see all the full module on all the QR code on the screen right now. So there's a full module based on the 7 live streams that we had, and all the live stream fluff is edited out, so you don't have to rewind, wind forward. What's the word for accelerate, speed up, or go through the hours of live streams? It's actually all the fluff is chopped out, and you can and it's a full module with all the papers attached. So if you're interested in this, go ahead and scan the code. And here in this our current paper, what do they say? They say, so many hurdles. For example, lack of regulatory oversight. And if you remember the paper about regulatory oversight from the 7-part series, oh my goodness, I didn't know how much regulatory guidelines are there in the world of digital pathology. Everybody thinks just, especially in the US, FDA, and they lag. They look at it very closely, and there's a lot of guidance, regulatory oversight, but definitely guidance and awareness from the regulator. So My friends, this one. Go to the 7-part series and you will know that regulatory oversight is there. You just need to want to find what they say. Then also data standardization. Yeah, this is a chronic problem in the digital pathology space, because we still we want to have DICOM, but we don't have DICOM everywhere, and different formats, and in general different data standardization. Data standardization is going to be probably a problem in the whole world, and also then insufficient knowledge and training. Well, I don't know. I'll told you that the abstracts like this are pretty difficult for Journal Club. We would need to go into the paper and read it. But one thing that I very much agree with is resistant to change, among others. And this article reviews current state of digitization and hematopathology practices and recent research using machine learning models, automated specimen analysis, and the offer intelligence-driven clinical workflows for efficient and comprehensive workup. And so, yeah, there are hurdles, but we can overcome the hurdles. We can, right? Us. Let me take the field of view. Now let's have a look at our last paper. Machine learning, deep learning, and artificial intelligence as applied to the field of cytopathology, a comprehensive review. So we have two similar. Everything is based on not on tissue, right? The hematopathology and cytology. And this one, it is a comprehensive review, Journal of American Society of Cytopathology. And this was a little bit more optimistic. Thank you for being a little bit more optimistic, because and it highlights something that I was asking myself about, and I keep asking myself about, because this digitization and the implementation of image analysis in pathology actually started in cytopathology, right? And it was a long time before whole slide image. Well, I don't know, maybe they used whole slide imaging, but anyway, they were ahead of our anatomic pathology times, right? So let's look at the paper. Imaging informatics have played in gynecologic cytology since the introduction of BD focal point and the ThinPrep imaging system. And that was at the dawn of the new millennium. So that was super early for digital pathology. That's the beginning. And the development of these systems nearly 20 years ago led to increased diagnostic performance with potential to address issues relating to speed, throughput, and reliability of cytologic assessment. So it's increased speed, increased reliability, and everything better. So let's take it and run with it, right? No, wrong. However, rather than ushering it in an age of increasing automation, what I would be very interested in, and I would want to do, and quantitative analysis, algorithmic advances in cytology and in pathology in general stagnated for approximately a decade after its introduction. And then in the 2010s, how do you say that? Let me put the chat. Maybe you have the right word for that. Oh, sorry. Confused with my screens again. Okay. There was AlexNet, and what a coincidence. My name is Alex. I had nothing to do with AlexNet. Coupled with plummeting storage and due cost, open source development, and also more affordable high throughput digital slide scanners accelerated this progress. So while the widespread adoption of large-scale consortium-level databases, for example, the TCGA, the Cancer Genome Atlas, spurred developments of models, algorithmic modeling of cytology specimens has lagged behind. So here we have the same problem, actually, that in the previous one. It has lagged behind due to the varied nature of cytology preparations and assessment. And you know what? I don't want to be overly enthusiastic, which I already am, anyway, but cytology is challenging. Okay, don't understand me. Don't get me wrong. It's more challenging to image, a lot more challenging to image than anatomic pathology, where you have like a super thin, nicely prepped slide, and if the histology lab knows it's going to be for digital, they're going to make it even thinner and more beautiful and all that stuff without any folds, and run automated QC tools. You cannot do that with cytology. What you have, you can preparation, still it's not going to be flat to struggle with imaging, but there are devices and that, right? However, increasing attention to cytopathology with a commensurate increase in publications. Yeah, in this journal club, we already have 2 publications, and commercial applications in this area. Still, applications of AI and machine learning to cytopathology and the Herculean effort to implement fully digital pathology services remains at its nascent stages. This review explored the current state of research and commercial development in digital cytopathology, with the focus on AI and machine learning technologies. And yeah, I mean, we're going to be reading about that a lot in many papers, that the adoption is lagging. And it is because I mentioned this this presentation I gave at the beginning at the annual meeting of Society of Toxicologic Pathology about neuropathology. About the use of digital pathology in neuropathology. And when I was doing research for, like, okay, in which medical institutions, not veterinary or pharmaceutical companies, but medical diagnostic institutions who is using for publications, I wanted that. There were publications saying, yes, we do it for everything. But then I had to actually on LinkedIn ask the people and say, hey, do you also do it in Neuropath? And they do. So, for example, I did reach out to Giovanni Lujan at Ohio State, and they do Neuropath digitally. I think for 5 years they've been doing that. And this was one of the first specialties where they implemented. And I don't know who else I checked. Mayo Clinic, some digital neuropathology service, and several, right? But I didn't find like a bunch of them. I found like 4 or maybe 6, and also Great Britain, Leeds Hospital, and also Granada Hospital in Spain. So internationally, a few more, but I didn't find references, specific references on more than 10 in neuropathology. So that kind of confirms that it's lagging. It is lagging. So we need to be active, and we need to help this to not lag by learning. What we can do is to learn. So if you're interested in started version, we need to update the couple of chapters because a lot has happened in the digital pathology world. So I'm already working on the new version. If you have this PDF version, and I know that you have it because you're in my database, and you will get the new version without anything additional. So if you don't have the book, or if you want a new version of this later, scan the code that's on the screen right now. And if you are proud of being a pathologist, being a digital pathology trailblazer, or anyone who looks under the microscope, who loves life sciences and laboratory sciences, you may be interested in wearing earrings like that. So I have them in the store as well. Let me show you the designs that we have. Let me put the store on the screen as well. Can I put all the codes? No. So the store, if you're interested in the earrings, getting it for yourself or for someone, this is in the upper corner right now. And my favorite are the multinucleated giant cells. These, I wear them at conferences and people stop and ask me about them. So now they can stop and ask you as well. The book is something I highly recommend for anybody digital pathology or already having some expertise in one area of digital pathology, but wanting to be. This book is a fast read and it's going to bring you up to speed. Thank you so much for joining me. If you're viewing the replay and you want any of the things that I'm offering here, just leave a comment and I'm gonna get back to you.